Good morning, everyone. The October 12th, 2021 virtual work session of the Anne Arundel County Council is now in session. Madam Secretary, please call the roll.
Ms. Lacey.
Present.
Ms. Pickard.
Present.
Mr. Volke. Mr. Volke will be joining us around 9:15. Mr. Pruski.
Here.
Fiedler.
Present.
Ms. Radvian.
Present.
Ms. Hare.
Present.
Ms. Bolayer.
Present.
Ms. Schuett.
Present.
Madam Chair, we have 6 council members present. We have our legislative council and our county auditor also in attendance.
Thank you. And we have our secretary. Good morning. Madam Secretary, please read the Open Meetings Act statement.
The county attorney has asked that I read the following statement. The Maryland Open Meetings Act is a state law that requires public meetings to be open to the public and to be held in places reasonably accessible to individuals who would like to attend these meetings. While a virtual meeting of this type was not envisioned by the Open Meetings Act, steps have been taken to ensure that this virtual meeting includes alternate accessibility features that the Open Meetings Act Compliance Board and the courts have previously reviewed and approved, such as having a call-in phone number that allows anyone with a telephone to call and listen to the meeting, broadcasting the meeting with video and audio on cable TV and the web, and allowing members of the public to register and watch this meeting using the Zoom application. The public access provided by this technology makes this virtual meeting reasonably accessible to the public as required by the Open Meetings Act.
Thank you. The County Council will now sit as the Board of Health. We do this twice a year. We last did this during the budget budget process. Dr. Nilesh Kalyanaraman will be joining us, and he will go into a presentation. After that, we will have council discussion. Dr. Kalyanaraman, good morning.
Good morning, Chair Lacey. Thank you for having me here today. We are here, our Department of Health leadership is here at Quiet Waters, try to recreate at least some of the feeling of being together during this pandemic. And I thank you for your time this morning. I'm going to switch over to a presentation. You all should have received it. We are not going to go through all of the material today. I provide that for your information and reading at your own time. I will go through a selection of content here, just in the interest of time. So if you'll give me one moment, I will share my screen and then we will get started. Good morning. I am Dr. Nilesh Kalyanaraman, the Health Officer for Anne Arundel County. The vision of the Department of Health is a vibrant Anne Arundel County with healthy people and healthy communities, and our mission is to preserve, promote, and protect the health of all people who live, work, and play in Anne Arundel County. I've listed our key staff here. Behind me, our key staff and our leadership team is here today. And we are happy to answer any questions and engage in any discussion at the end of this presentation. So I want to acknowledge our partner agencies, Adrian Michael, the Mental Health Agency, and Pam Brown, Partnership for Children, Youth, and Families, with whom we work very closely. The Department of Health was founded in 1930. Our operating budget is over $80 million now and has grown significantly over the past year and a half due to COVID. We have 893 employees, growth of almost 100 positions in the past 18 months. And I want to take this moment to acknowledge the work of all of those, the Department of Health, who have, over the past 18 months, put their heart and soul into protecting the health of the county in ways both related to COVID and unrelated to COVID. They have gone above and beyond in adapting their work to accommodate COVID, to provide care to all those in the county. And we will talk a little bit about what that looked like during the pandemic. They have responded to COVID, as you all are certainly aware of. Things move very quickly in COVID time, and those adaptations come fast and hard on all of us. And so our staff continue to give their all to this county. I want to take a moment to thank them. I will start with COVID. We've obviously had opportunities to talk about this, and so I'm going to touch more on the highlights of where we are in terms of our current situation and where we are going forward. So at this point, as of October 1st, we've had over 50,000 cases in the county and over 721 deaths. And that number has certainly grown in the past week or so. We see our hospitalizations, and I bring this up first because this is what we are really keyed in on. As we do a couple things, we have our mitigation strategies, which we've talked about, distancing, masking, but vaccinations are a key tool. And that's why you've seen hospitalizations go down, but we are always keeping our eye on our hospital capacity. And so what we're seeing in other states where there are lower vaccination rates is that their hospitals are getting overwhelmed. We are not in that position because we have done a good job vaccinating and getting vaccinated in this county and in this state. But with COVID, with the Delta variant, we need to get more people vaccinated to get, one, people safe and avoid the most severe consequences of this illness, and two, to decrease the pressure we're putting on our hospitals. They are definitely feeling it. We are in constant conversation with them about this. They're constantly aware of the toll this is not taking just on their staffing, but also on how they provide care to everybody who's coming to the hospital. We see our cases in the past month and a half or so have leveled off at around 17 to 20 per 100,000. And I think most importantly, what I want to share with you is these next two slides, which show the hospitalization based on vaccination rate. That red line is the hospitalization rate for people who are not vaccinated. That green line is the hospitalization rate for people who are fully vaccinated. And what you see is that the hospitalization rate, this is in our county, the hospitalization rate is about 3 to 4 times higher for people who are not vaccinated than for those who are. When we look at that same thing for the case for the case rate, the red line is the case rate for those who are not fully vaccinated. The green line is for those who are fully vaccinated. And we see that again, about a 3 to 4-fold increase in case rate for those who are not fully vaccinated. And I share this with you to highlight the importance of vaccination, the effectiveness of vaccination, and that it is making an impact in our county. And so that is why we will continue to push vaccinations as our best path out of the pandemic. We have talked a bit about the disparate impact of COVID-19, particularly on those minorities, Blacks, and Hispanics. And we see the death rate, particularly in the past month, is higher amongst Blacks and Hispanics. And then overall during the pandemic has been higher in Blacks. The case rate as well has been disproportionately higher in those groups as well. It is the reason we have focused our health equity efforts on COVID and also our vaccination efforts. We've talked in previous sessions about our equity efforts around vaccination. We'll talk more about that in a minute. When we look at vaccination rates by age group, we see that about 77% of county residents aged 12 and older, so those who are eligible, have gotten at least one dose of the vaccine, and that 72% are fully vaccinated. That is a very good rate, but it is not yet high enough. We need to get even higher in order to really decrease our hospitalizations, decrease the spread, and allow us to move forward. So mentioned in terms of our vaccinations, we're in multiple locations throughout the county. You see a listing here, but I want to highlight particularly our community efforts around this. We've made it a priority of ours to be in accessible locations. And so that means partnering with our schools, faith-based institutions, businesses, corrections, other types of community organizations to be able to go out and provide vaccinations where people are. One of those projects was our Health Ambassador program, and it was a program where we funded 9 different community organizations to do the work of building community capacity to do outreach and provide factual information around the vaccine in underrepresented and minority communities. We looked at the census tracts that we were going to target and zip codes based on vaccination rates and based on case rates. And so those tended to be in areas with higher minority populations and lower economic status, but not exclusive. But our approach was data-based. And what we've seen is that nearly 15,000 households have been visited. We've had 522 residents sign up directly with that health ambassador, 15,000 pieces of PPE and face masks, but particularly trends for vaccinations increased significantly in the targeted census tract, and that's what we're looking for. We've talked about a range of response activities, including testing, vaccinations, contact tracing. Our call center, isolation, quarantine continued, that support continues. Education, we continue to work with the business community, and then critically mental health resources and vulnerable population support. We'll talk more about that. Just wanted to give you one sense of the type of communication and media that we're putting out there to be able to engage people on getting the vaccine. Of course, no conversation on this will be complete without a discussion of what we're doing in schools. I'm going to be talking specifically about the contact tracing piece of this because that is the area that we've got the most questions on. So we have a school health contact tracing team. So does AACPS. We work hand in glove with them, and we work together to reduce the spread of COVID. These are stats just from the beginning of September. The beginning of this school year in September. I did not include the last few months, because it was a very different condition at that point. But as you can see, this is a lot of work to isolate or quarantine nearly 5,000 students and staff. And that's reflective of the high case rate we have. When I said that we have a case rate of between 17 to 20, this is the consequence of that. It means that there's a lot of cases. It's also compounded by the fact that it's cold and flu season, and there are a lot of symptoms that need to be addressed to at least make sure that it isn't COVID if it's something else. Here you see some data on the number of positive cases, students with COVID symptoms, and exposure, and then the daily total of students in isolation and quarantine. You can see that after growing pretty significantly, it came down in the last week of September. We'll be updating this data monthly. At the same time, our school health staff are doing diagnostic testing, and they've been doing that since the end of last school year. The diagnostic testing is predominantly rapid, some PCR, tests for students with symptoms of COVID in school. I'm going to stop with COVID there and then now just transition to some of our community initiatives. First, I want to start with our Healthy Anne Arundel Coalition. We talked about this, and I want to thank Councilwoman Fiedler for her leadership on this coalition. It's a county-wide collaborative comprised of community organizations, faith-based institutions, economic development, federally qualified health centers, hospitals, and county government agencies. And its real goal is to identify and address the community's priority health needs and to align resources within each member organization to achieve those common purposes. This is our common agenda. These focus areas were determined by the community. So focus on mental health, obesity, COVID-19, and healthcare access. COVID-19 is obviously something that we have been focused on with the community, and so while we may not be addressing that through Healthy Anne Arundel, there are many other pathways to address that. So far, we've focused on mental health and obesity, and we'll address healthcare access in the coming months. First, we'll start with the mental health piece. There's a number of activities that we have coming up. One is promoting the Anne Arundel County Network of Care. The Network of Care is a way to identify mental health treatment services throughout a range of mental health treatment services throughout the county. It's a way for providers to put their information there, and also more importantly for community members to identify resources when they need it. One of the most challenging things is that while we may be promoting and advertising services until somebody actually needs it. They're not really going to pay attention to that. That's extremely normal. And so what we're trying to do is make sure that this information is there and available when people need it. And then the last piece of that is recruiting community members to join this coalition and actively engage in this work so that we can continue to make this information available. The second item, obesity was noted as a community priority. We are going to focus on that as healthy eating and active living. Our HEAL work group is looking to increase community access to healthy and nutritious foods, access to active living activities and programs, education for the community, and then partnerships throughout the community. This work is just getting started, and we'll have more to share about this when we next meet as the Board of Health. Switching to our health equity and racial justice work, we've talked about this work as well, that health equity means that everyone has a fair and just opportunity to be as healthy as possible. We've shown data, I just showed you a little bit about COVID, that there are racial, ethnic, income, and geographic disparities. And our goal really is to look at that data and understand what is happening and use that to make decisions based on the data. Part of that is we stood up the Office of Health Equity and Racial Justice. I just mentioned the Health Ambassador Program. That is a program that came out of this office. Of course, COVID-19 and health equity has been a key priority of ours as well. We last time talked about our principles for equitable vaccination and our grant program to provide rent and utility assistance for those who didn't meet criteria for other programs. I'm going to take a moment to brag a little bit. This office was awarded the Innovation Award by MACO just for 2020, just this past summer. Moving on to our gun violence intervention team. This is an area that we prioritize to address gun violence as a public health issue. The multi-agency effort utilizes a policy systems and environment public health framework that really looks at how do we decrease violence. It's modeled on our opioid intervention team. I want to talk about some of the activities that we're undertaking. So there's three main priorities that we have right now. One is creating and publishing a monthly data report, gun violence data for the county, to develop and implement a public awareness campaign about safe gun storage to prevent gun violence. And the last is implementing a coordinated crisis response for reporting and follow-up on gun violence incidents in Anne Arundel County. So in that first piece, there is a gun fatalities dashboard now available on our website. It's going to be updated monthly. It shows gun violence data for the county. It's both a map and a list of 2021 firearm injury data. So we see that there's 27 suicides by firearm to date in 2021 and 12 homicides. This data is broken down by neighborhood, and I'm going to show you that in a second. There's also some more historical data with maps of firearm suicide and homicide rates from 27 to 2020, so that it gives us a little bit more of a historical perspective on what is happening throughout the county. And as a snapshot, this is what that data looks like of what's going on this year in our county. So you can see that the map with the blue icons is gun-related suicides. The red icons is gun-related homicides. It allows you to see very generally where these incidents are happening throughout the county, and also a month-by-month tally. I encourage you to take a look at this data. It is publicly available. We also have a public awareness campaign, suicide prevention toolkit, about knowing the warning signs, reaching out for help, and then also how to secure your home through safe storage of firearms. And the reason that safe storage is important is that we know that people who are having active suicidal thoughts, if there's an available method, can impulsively use that. When they are starting to have these thoughts, if they have the resources to safely store those weapons, when they're having suicidal thoughts, they are less likely to have access to a lethal means of suicide. In that way, we can save their life, because people who do have suicidal thoughts can and do recover. And so being able to save their life in that moment will allow them to get treatment and be with us. We also have targeted information for veterans, minority communities, and particularly clinicians, including counseling on access to legal means. Counseling on access to legal means is, in the clinician setting, is about talking about prescription drugs, firearms, and decreasing access to those because of what I just talked about with the safe storage. If you don't have access to those, you're less likely to be able to die from suicide. And these are a couple of examples of the materials we are putting out and that are being distributed. And then lastly is our gun violence coordinated response. Sorry about that. It builds on a robust network of crisis and emergency response teams to develop a response plan for gun violence incidents. And the goal is to be able to care for not just those who are directly affected by that gun violence, but family, friends, neighbors, colleagues, and community. And this is the one piece that we're looking to really develop over the next 6 months or so. And so we'll have more about this. This is a flyer from our last community meeting in June, and we have another one coming up later this month. And then suicide prevention. So suicides have decreased from 79 in 2018 to 75 in 2019. We are waiting for finalized 2020 data. Preliminary reports suggest that did go down, but I can't speak to what that looks like yet until we get the final numbers from the Maryland Department of Health. But there are a large number of suicide prevention events, efforts taking place. The Mental Health Task Force, which is co-led by Mental Health Agency and the Anne Arundel County Public School System, is doing fantastic work with our school children to address mental health. I'm going to touch on a few of them, but recognize that there are a lot more efforts on that front. Mental health first aid training to police, school health staff, libraries, faith leaders, and community organizations is a way to provide that training to those individuals so that they can recognize the signs of mental health, provide support and resources to those people that they are interacting with who may need help. We just discussed lethal means reduction through safe storage, the STAR program in the school system, in our school health rooms. The STAR program is essentially a telehealth opportunity, and we had started this a few years ago, where students in high school could come in, ask for this, and be connected by telehealth for substance use services. That's expanded to mental health, and we're expanding into middle school as well. So it provides another avenue for students to get engaged into care. Mental health clubs for high schools, working on expanding those. I just mentioned the suicide awareness campaign, and that is actually, this is also something the Maryland Department of Health is doing. And so we're partnering with them on those resources. Our 24/7 warm line that's run through the Mental Health Agency. For the past number of months, we've been carrying out a suicide prevention awareness series with Kevin Hines, who's a nationally known speaker on this issue. And it's been a really just powerful series on raising awareness around suicide prevention and also giving support to people and resources on how to get care when they need it. We've also provided some prevention mini grants to organizations. Just the past month received grants for the following activities to address mental health, suicide stigma, and/or suicide prevention and awareness, suicide prevention and public awareness training, activities that reduce access to lethal means of suicide, and any other evidence-based activities. I want to transition to some of our core activities that we've obviously had to adapt during the time of COVID. But our behavioral health system is a collaboration between our Department of Health and our Mental Health Agency. It is a fantastic partnership. I would dare say that it's a model for the rest of the state in terms of the level of collaboration, integration, and also forward thinking. We've talked quite a bit about the effects of COVID-19 on behavioral health. We've seen a significant increase in requests for services through the crisis response system and the mental health agency. Fortuitously, we've seen that opioid overdose in the county are slightly down from 2020. That trend was worrying at the beginning of the year, but we are seeing that is coming down. That said, it is still high. We still have the third highest rate in the state, and it still warrants a full court press on this issue. In terms of the behavioral health effects of COVID-19, the effect on families, children, and the elderly has been significant between managing virtual and in-person schedules, social isolation, anxiety, depression, and effects on the workforce. I think we all know both academically, but more importantly, personally, that it's had some tremendous effects, and it's going to take us a little while to work through that. There are some opportunities during this time, though. We are seeing more individuals discussing behavioral health and wellness, and that is important that we hope to continue that trend. An increase in service demand, showing that individuals are willing to reach out for support. Talking about this destigmatizes mental illness. And that is, I think, a critical part. We've talked about stigma reduction in a variety of spaces. Well, this is a real-time, large effort where we are destigmatizing discussion around mental illness. And I include this just for those who are watching. These are what to know, the signs of a behavioral health crisis: social withdrawal, loss of interest, reckless or impulsive behavior, paranoia, or extreme changes in mood or sleep. There are risk factors: mental health disorders, alcohol and other substance use disorder, history of trauma, sudden loss, easy access to lethal means. And I want to take this moment to plug our warm line, which does fantastic work. Number is 410-768-5522. It's available for anybody to call. If you just need to talk to somebody to learn more, or if you need to get treatment, whatever you need, they can answer it. We'll talk about a few of our specific programs. Our Strengthening Families program is an evidence-based 14-session program which provides training in parenting, building children's social life skills. It's a multi-family group intervention. And I highlight this as one of those programs that had to change a lot during COVID. The whole point was to bring people together to do this work over a meal. And so our teams had to figure out, how on earth do you do that in the Zoom environment? And so we had staff going around delivering pizzas sometimes, making sure they're getting there, to make sure that food was ready there for the families as they were doing this work. For this effort, we were awarded the Bronze Award for Innovative Practice by NACHA, that's the National Association of County and City Health Officers. We're quite honored by that recognition. Telehealth is something that has exploded during COVID. It is actually just fantastic that this was the spark to make it happen. We've been talking about that for a long time. And what really had to happen was that Medicaid had to be able to pay for that, and they have, obviously, during COVID. It's an expansion not just of video calls, but also audio-only calls, although the audio-only part is only through 2023. But our clinical services were equipped with cell phones, laptops, DoxyMe, which is a particular type of video conferencing platform for healthcare providers, Zoom and EHR. And I think the important take-home is that we see from patients that they do benefit from this hybrid model of care. There are times where it is necessary or appropriate to have an in-person visit, but there's also times where it is perfectly reasonable to do a telehealth or even an audio visit. And being able to mix and match those modalities does help with retention. So the program is our WellMobile. During COVID, we were not able to put our WellMobile out into the community, but we did adapt by making our WellMobile services telehealth for the entire county 5 days a week. Just as a reminder, our WellMobile provides on-demand initiation of buprenorphine. So it's a real-time service for folks struggling with opioid use disorder. And it also provides other services, linkages to care, harm reduction services. It's really meant to engage people who are seeking help and provide them with a range of services. But as things were getting better over the summer, we were able to get our WellMobile back out on the road. It is now 2 days a week in Annapolis. It is 1 day a week in Glen Burnie, and we're searching for a South County location actively. Critically, 56% of those served are referred to a community provider. The goal is not to keep them in care in the WellMobile, but to transition them to a community provider. 87% of those referred keep their initial appointment. A critical part of this is our hub and spoke model. It's a network of community providers around a central hub, and that's the health department, to offer medication for opioid use. And it really utilizes the chronic disease paradigm for this care. So when somebody has opioid use disorder, if they're fairly stable on medication, routine care, those can and should be handled by primary care provider. When there's a worsening of the condition, they get referred to the hub. That's us for more complicated care. This is what we do with many other diseases, whether it's diabetes, heart disease. A lot of the care is provided in the primary care setting, and then you use specialists for any adjustments or worsening of conditions. So the hub and spoke is using that chronic disease paradigm, and it facilitates those transfers between the hub and the spoke as needed. And so it gives greater opportunities for people to engage in treatment by making community treatment more readily available. These services began in May. It includes our Road to Recovery clinics. We currently have 7 spokes that are participating, and our team consists of a nurse coordinator, behavioral health specialist, and a buprenorphine coordinator to work with and coordinate with these primary care practices. Our safe stations, which we've talked about a lot, continue to operate even through the pandemic, and are a critical part of our response to those seeking care by providing easy access to entry into treatment at any of our fire departments or police stations. But I think just as critically, we're seeing that our crisis response staff are also meeting people out in the community as is appropriate. So providing additional alternatives for how to meet and engage into treatment. And we continue to refine and evolve as demand changes in the county. Harm reduction is a critical part of the work that we do. Harm reduction is essentially about meeting people where they are and being able to reduce the harm that is happening. Our overdose response program is one such example. It helps people understand how opioids impact the brain and body, how to recognize signs and symptoms, how to administer naloxone, also called Narcan, which is a life-saving medication, and it operates along the same principles, right? If we can save somebody's life, we can get them into treatment and into care. If they die, then there is nothing left. And so we are committed to not allowing that to happen by continuing to provide that education, that naloxone, and then critically, those connections to care. AA Power is our street outreach arm of harm reduction, centered mainly in Annapolis and Brook Park, where there is the highest rates of overdose and also has the highest needs for these services. Part of that is our syringe services program, which was authorized by the Maryland Department of Health, which includes a range of services, including syringes. And these are the types of referrals that are made. We've talked to nearly 2,000 individuals on receiving harm reduction materials, 174 substance use disorder treatment referrals, 172 mental health treatment referrals, 115 healthcare referrals, 172 for housing, 102 for food, and 168 for HIV, hepatitis C services. And I highlight this because it's really important to understand that what we're doing is we're engaging people around this issue of drug use disorder but there's a whole range of services that they need. And each person has a different set of needs. And so that's really what our staff are out there doing. They're engaging people, providing them connections to the services they need. And that is a part of their recovery. And being able to get healthcare or get housing is a key step in their recovery. And that's the power of these harm reduction services. We also work with pregnant women and women with children to particularly those with opioid use disorders, to connect them to resources of recovery. We know that intervening early with pregnant women and early with women with children is going to be critical for their longer term success, both for those women and also for their children. And then lastly, just want to touch on our opioid intervention team. It's a countywide collaborative led by the health department, County Office of Emergency Management, the Indianapolis City Office of Emergency Management. It brings together a range of actors to look at what are opioid responses around the county, and not just from a health standpoint, but from our law enforcement, from our judicial system, from our social services to our housing. And it is a critical part of how we do this work. Every county in this state is required to have an opioid intervention team, and so this is a part of the state framework. Switching a little bit to our crisis intervention teams. These are designed to prevent crises from escalating into more intense situations, reduce hospitalizations, reduce incarcerations, and reduce homelessness. Critically, part of that work is care coordination. So connecting people to treatment resources and other benefits. You'll notice the theme there. We talked about that with our Power as well. A lot of the health issues that we see are interwoven with other issues that people have: access to care, housing, food access, employment. And it isn't an either-or strategy. The goal is to make sure that we're connecting people to all of the resources they need, since those are necessary for their recovery. Critically, we've seen an increase in the utilization of warm line and mobile crisis team services. Warm line services went up 30%, mobile crisis team services over 28% year over year. And as an important note, there were minimal to no requests from schools during COVID closures, which likely would have increased the need for services further than that. Training is a critical part of what happens for our crisis response. We talked about our mental health first aid. Another piece of it is our crisis intervention team school. It's 40-hour training for our police officers, specialized intense mental health training, and provide that to other law enforcement officers as well. Switching gears, talking about our HIV and sexually transmitted infection prevention and care program. These are programs that look to prevent HIV transmission and also provide treatment and care through case management and partnerships with Johns Hopkins for those with HIV or AIDS. Our case management services operated during the pandemic. Obviously, we had to make some alterations to how that worked, but we had 214 clients served, 23 new clients. I mentioned our partnership with Johns Hopkins Community Clinic. They provide primary HIV care. They worked with 122 clients. One of our key priorities in the coming years is increasing the number of mental health visits and integrating that care into our HIV care. Chronic disease prevention, our cancer screening services. This is a core part of what we do, but providing breast and cervical cancer screening services to women who are county residents and have incomes equal to or less than 250% of the federal poverty level, don't have other ways to access these screening services. This program provided linkage for 794 clinical breast exams, 780 mammograms, which resulted in 3 breast cancer diagnoses, 394 Pap tests, resulting in 1 cervical cancer diagnosis. And you see that 1 lung cancer screening. That's because we are just launching our lung cancer screening program. And that is something that we will see growing over time as lung cancer screening protocols change. And we will see the efforts of that increased lung cancer screening, early detection and treatment. Along that same line, tobacco use in cancer prevention is critical. I want to highlight particularly our tobacco prevention efforts. We were talking a lot about vaping in youths in the early part of 2020. A lot of those efforts were scrambled due to COVID, both in terms of understanding what those usage patterns were by youth, but also by limitations in terms of how these programs can be delivered. And so we've been ramping those services back up again. 82 tobacco prevention and awareness activities were conducted by our partners, our county exec's office, to reach adults and youth. Additionally, 26 cancer prevention and screening activities as well. As I mentioned, one of our priorities is to increase our lung cancer screening program, develop vaping and smoking cessation resources for youth, and to partner with low-income housing locations to increase access to smoking cessation resources. Food access has always been a critical issue. We have produced maps and data on differences in healthy food access throughout the county. One of our efforts to address that is our healthy food pantry, which focuses on now curbside food and health education distribution. It used to be an indoors event, obviously rearranged by COVID. You can see some of the photos there. We distributed over 28 tons of food just in that 5-month span. Over 40% or over 11 tons were fresh produce. And I think that's the key to remember here is our healthy food pantry is really focused on produce, dairy, fresh proteins, not just canned or dry goods. And so it's the foods that people are going to be able to cook and be able to have healthy meals from. A range of priorities for the coming years, partner to increase mobile community produce and food delivery, so addressing those transportation barriers, and also looking at how we can complete this our South County community food assessment and build those partnerships. The farmers market, the Brooklyn Park Farmers Market is a joint project between the schools and the Department of Health, and it runs throughout the entire summer. It's the only one of 2 markets in Anne Arundel County that accepts federal nutrition benefits, provides free lunches, free books, and other resources, and is a critical part of what we do, and we'd like to look to expand those farmers markets throughout the county. Our Healthy Start Home Visiting Program provides wraparound support to include mental health, personal violence prevention, and substance use screening for families, and health information. In the previous year, we had 133 women who were impacted by substance use, 115 of 120 newly enrolled pregnant women resided in high-risk census tracts. And so we look to make sure that this program is really reaching those in the highest risk census tracts and improve birth outcomes. You'll see below 22 out of the 29 births were greater than 2,500 grams, which is what we want to see. 7 births were a lower birth weight, which is what we are trying to avoid. We also provide some dental services. Our North County clinic had to be retrofitted and updated, and so we had to take it offline for a number of months, but it is back up and running. And it's providing care for predominantly children, as you can see, but some adults as well who don't have access to dental care. Critically, one of the things that we do is partner with schools to provide, in certain schools, to provide a dental sealant program. That's a program for 6 to 9-year-olds to prevent cavities, and is a way to extend our dental preventive services. And then our other program for accessing care is REACH, which provides access to low-cost primary, preventive, and specialty health care to uninsurable and low-income individuals. And that's a program that we are continuing to grow as we see demand for that increase. Coordinated care for over 1,000 enrolled members in the range of services that you see there. School health services. Obviously, these service numbers are going to be very different than in prior years. This is for the school year 2020 to 2021. typically we have far more total health room visits, but I did want to share that our school health staff continue to do not just the COVID services that we talked about, but all of their core school health room work, which is addressing emergencies, crisis interventions, medication management, urgent care visits, education, and the like. We'll take this opportunity to make a plug. We need more school health staff. And so we continue to hire and train school health staff, hired 30 registered nurses, 2 licensed practical nurses. And also we do CMT training. Strongly encourage those who are interested to give us a call. One of the key things that we were focused on was school immunization compliance. This is something that we do every year. There is a schedule of vaccinations that are required for students in entry into various grades. And we typically, there's a few weeks grace period at the beginning of every school year, in which kids who are not yet caught up on their immunizations need to get caught up. We have been working with the school health system to offer a range of vaccines in schools over the summer in order to make sure that we're getting those kids caught up and also sending out information to them so that they are. We're happy to see that we have a 99.9 compliance rate at this point. There's only 420 students who are out of compliance. We continue to work with them, but that has been a key success, particularly after last year, where we know that a number of primary care services and immunizations were deferred. And just for reference, this is the schedule of vaccinations that are required by vaccine and by age/grade level. I mentioned the expansion of our STAR program. We're excited to see what that looks like, and we'll be sharing more data on that as the year goes along. And then lastly, we added school health services to our evening high school program, which we're happy to have done so. Switching to our food service facility inspections, I want to highlight that work continued throughout the pandemic. Obviously, there were modifications made to that, but particularly I want to hone in on the 165 licensed mobile units, which were a valuable resource to the county. They provided services to the communities. Mobile trucks will go into neighborhoods to provide meal options for working families and children, and they continue to be a key part of special events throughout our county. And then lastly, I want to touch on rabies and our oral rabies vaccination program, which is a key part of our prevention strategy. We distribute over 84,000 rabies vaccines throughout the county in largely undeveloped areas, large farm and wooded areas. Most of it is distributed by air, actually. Very little is distributed on ground. But this is what it looks like when we look at the number of rabies cases in animals. When we began this program in the late 1990s, there were nearly 100 animals with rabies. And the reason that's important is that those exposures with people can lead to rabies, which is nearly universally fatal illness. By decreasing the level of rabies in our wild terrestrial population, we're able to prevent rabies infections in people. And you can see that over a 10-year span, we brought that down. We brought the number of animals who had rabies down. You see that bump in 2013 and 2014? That's when our program went unfunded. We started to see an immediate rise in number of animals who had rabies. And I think it's a really clear demonstration of the value of prevention and also what it looks like when you take preventive services away. Oftentimes we get used to the landscape where preventive services exist, whether that's vaccinations or rabies vaccinations for children or rabies vaccinations for animals. And when those programs go away, you see the impacts in a way that you couldn't while the program was in place. And so with that, I want to thank you for your time and happy to answer any questions you have.
Thank you very much, Dr. Kalyanaraman. Of course, there will be lots of questions from my colleagues, and I'm not necessarily going to be able to follow an order of whose hand or flag pops up because of how the windows shift on the screen, but I'll try. Mr. Pruski.
Good morning. Thank you, Madam Chair, Councilman Pruski, District 4. Dr. Kalmi-Raman, I wanted to ask you in particular because the helicopter that you mentioned for the use of dropping rabies, I know there was a concern about us funding such a significant piece, but can you explain how important that was to be able to drop, via air versus on the ground and the man and resources? Again, I know you can't quantify it maybe in finances, but I think it's important to point out the importance of why we kept that, not only for police and public safety purposes, but how that changes to be able to have the air versus on the ground. Thank you.
Absolutely. I'm going to invite up our Director of Environmental Health, Don Curdian, to talk a little bit more about what that was.
Hi, Don Curdian, Director of Environmental Health. Hi, Mr. Pruski. Last year during the pandemic, the helicopter was extremely valuable because we couldn't send our teams out to do groundwork like normal because we normally have 2 or 3 man teams and we couldn't have that many staff in a car. So we did more by air than we would normally do with ground teams. This year and every year we've used it, the police department is extremely valuable because they are dropping a larger percentage of the vaccine or the baits in all the areas in the county. The only ground teams are just going into the neighborhoods, and the rest of the county is all being done by the helicopter. And it's a very low cost for this program because the police department, we're only paying for fuel, and the police department gets their flight hours in as training. So it's a trade-off between the health department and the police department. And it's been a very valuable team to be able to add to this effort. And if we did not have the police department, we would have to hire a private firm to do this work, and the cost would be as inexpensive as it is now.
Thank you.
Ms. Radvian.
Thank you, Madam Chair. Lisa Radvian, District 6. So I just want to start out by saying I am so impressed by the amount and the quantity and the quality and the breadth of the work that the health department is doing. It just seems like you have so many bases covered, especially at a time when there are so many needs. So I just wanted to start out with that. My next question is forward-looking. I know many parents of children ages 5 to 11, their teachers in the schools, and the young people themselves are very eager about the hopefully very soon emergency use approval of COVID vaccines for children ages 5 to 11. And I just wanted to hear about any plans that you have for rollout for that vaccine. If there will be opportunities to partner with schools, public schools, as well as private schools, and what kind of what kind of work you're doing with respect to that upcoming, hopefully joyous occasion.
Dr. K, you're muted.
Sorry about that. I was just saying that I was inviting Tony Gettin, our Deputy Health Officer for Public Health, to talk a little bit about this.
Good morning. So in anticipation of the approval of 5 to 11-year-old vaccines, we started working with the CPS several weeks ago to identify ways to get into some of our Title I schools and areas really most in need. So that's one of our main interventions for targeting populations most at need. So looking at our Black and Hispanic children, looking in neighborhoods where maybe access to transportation is an issue, and hoping that into those elementary schools we will provide close access for families and an environment that they're used to. And this isn't new. School health has been providing flu vaccines in schools for years. So this is an extension of that work. We also partnered with AACPS to provide vaccines for the older children in schools over the summer. So several school clinics have already been done, and we continue to really want to grow that model and make sure that we're getting those vaccines out into the community. And we think that elementary schools are really going to be the best way to get across the whole county in a number of different areas that may have access issues.
We've also been
I'm sorry. Go ahead, Dr. K.
Yeah. We've also been partnering with pediatric practices around the county for many months now to make sure that they have the workflows and supplies they need to be able to do vaccinations as well. And so that's another part of our efforts.
And we will continue to provide vaccines at some of what we consider our standing sites. So working with the Arundel County Community College, our Bay Meadow drive-throughs, so places that we've been providing vaccines that families who maybe don't have access issues or barriers to transportation could easily bring their children. So trying to really approach this from
Thank you. Madam Chair, could I ask one follow-up question?
Can I ask you to hold it, please? And then we'll come back to you, unless you have to leave.
Okay. No, I'm fine.
Okay, thank you. Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. First, I want to say thank you, Dr. K, for mentioning the South County partnerships that you guys are working on. I know we had talked about it the last time we met, and I appreciate your follow-up on that. I'm excited to see where that goes. I have a couple questions, some COVID, some not. So I'll start, I guess, with the COVID one, since we were just talking about that. Dr. K, you mentioned almost 5,000 students, I think it was, potentially in quarantine at the school system, in the schools as a result of, and, I saw there were 500 and some odd positive tests, and then there were 2,800 or so symptoms, maybe 80 probable cases. So I assume a lot of those symptoms are not COVID. I had this come up in a school of mine, and you and I spoke about this, or not my school, rather, a school in my district, and you and I spoke about this, about kind of the distance between students and how it is we're making those decisions to have a student quarantined. It's my understanding it's a 3-foot distance, but who is making the determination that a student was closer than 3 feet? And how are we using that, if that's the basis to quarantine somebody and, really kind of disrupt their schedule and send them home for 8 days, 10 days, whatever it may be? And how are we, nobody's taking out a yardstick. How are we measuring that 3 feet?
Sure. I'm going to invite Aisha Alston, our school health, who honestly, I think knows more about this than anybody in the county. Has the lack of sleep to prove that.
Good morning. So the determination is made in the classroom. It's a collaborative effort between the school administration as well as the school health staff. So we go to the classroom, we're looking at seating charts developed by the teachers, looking at the classroom, the cafeteria, and the students travel throughout the day, the seating arrangements, activities that they participate in that would require them to move from their seats. And so with the teachers, the school health staff, and the school administrator collaborate to make that determination.
So just ma'am, let me, as a chair, I need to remind everyone that, especially if you're a panelist, to please identify yourself and the office you work for before you begin speaking. So I'm not sure if you could do that now, that would be great. Thank you.
I'm sorry, my name is Aisha Alston. I'm the Deputy Director of School Health and Support at the Anne Arundel County Department.
Thank you. Ms. Hare, I want to try to go around to everybody. So is your question an immediate follow-up, or can we go hold the rest till next time?
It's an immediate follow-up for, but I can hold it, but we just may need to bring her back up if
that's okay. I think that's what we're going to end up doing, just trying to circulate through everybody. Ms. Fiedler?
Thank you, Madam Chair. Amanda Fiedler, District 5. So, Dr. Kalyana-Raman, thank you for your presentation. And I wanted to go back to one of the statements that you made, that the hospitals are definitely feeling it regarding the, uptick in cases recently. So in talking to leadership at both of the hospitals, the staff has indicated that they're not anticipating a spike like we saw last year over the November to January timeframe. Certainly, they're anticipating some type of spike, but not anything near what we had last year. And they also feel that they have better tools or understand the virus much better to treat more effectively than they were able to last year. Would you agree with that from what you're seeing in your department?
Yes, so that is correct. We do not anticipate a peak like we saw last year. In fact, in our discussions with them, there's a couple of things, right? There are more effective tools for treatment, but more importantly, there's vaccinations as well. And that's led to what we're looking at is over the next 6 months is what does cold and flu season look like with COVID and vaccinations? And so we saw, I think it was maybe a month ago at this point, Arundel Medical Center had to defer a handful of surgeries, right? That were going to be done on an outpatient basis, might require hospitalization. I think that's the sort of impact that we're talking about, that kind of level generally, right? We're not talking about what we see in other places where there's a massive rush on the hospital. And so it stresses them and it kind of puts them in a position of continuous stress until they equilibrate to what this new normal is going to be.
Sarah Lacey, District 1, I have a question on a similar vein. What, if anything, is our health department doing to support, in particular, the the mental health and other needs of our medical personnel throughout the county?
So that's something that we've been talking about a lot. We talk about that with our hospital partners, but with our other healthcare partners. I'm going to invite Cindy O'Neill, who's our Director of Behavioral Health, to talk a little bit more about what that support looks like in the community.
Good morning, Sandy O'Neill, Director of Behavioral Health, the Department of Health. I think that's a great question, and I'm going to answer it in a couple different ways. One of the things that we're doing is certainly working with our partners. Some of the hospitals, for example, will have things like resilience rooms and lunchtime talks and things like that. We are also just working in general in the county along with our partners at the mental health agency to increase messaging and information about wellness. So it's not just a lack of mental illness, but it is overall wellness. What does that look like, and how does that interact with somatic health and dental health and all of that? And how do we look at people as whole beings? So that is very much a very active conversation that we're having with our partners in healthcare, as well as just community approach.
Thank you. Ms. Radvian, and then Ms. Hare.
Thank you, Madam Chair. This was really related to possible upcoming vaccine rollout for young people ages 5 through 11. And I'm sorry, I'm not hearing everything super clearly today. It may be my connection, but I just wanted to ask and confirm that indeed middle schools were covered as part of that rollout, because I'm sure you're aware that there are 11-year-olds that have not been eligible until, well, are still not eligible, but hopefully will be eligible soon. And just wanted to make sure that that was part of the plan as well.
I don't believe that we have any middle schools scheduled at this point. Remember that any child 5 to 11 is eligible to go to an elementary school or to go to any of the other sites under pediatrician. If as we're doing this, we see that we need to schedule it, we can. That's easy enough to do.
Ms. Hare?
Thank you, Madam Chair. Jessica Hare, District 7. I just, following up on the whole quarantining of students and understanding the disruption, I just wanted to make sure that what I understood is that it's based on a probability that someone might have been within 3 feet and not confirmed actual, yes, I was in 3 feet, or that. It sounds like we're looking at where their desk may be on a seating chart, but not necessarily that they are actually confirmed within 3 feet of whoever tested positive.
I should look you.
Sorry, thank you.
No, that's fine.
Thank you. It's Aisha Olson, Deputy Director of School Health and Support. It is an actual determination. So we have conversations with the teacher in the classroom in regards to where the students are sitting when they're in their seats, as well as the activities that they do in class. Sometimes students are not in the seat all day. Teachers have lessons planned that include activities that involve going into the hallway, going outside. So it's an actual conversation with the teacher about the classroom setting and what happened in that classroom and where the students were.
Okay. Thank you.
You're welcome.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. Dr. Kalyana Raman, since we discussed vaccines for a few slides, can you explain the difference between non-sterilization and sterilization vaccines?
Can you say a little bit more about what it is that you're asking about?
Well, I received some questions from the public asking if the COVID vaccine is considered not a non-sterilization vaccine or a sterilization vaccine. And then there were some questions, follow-up questions to that question on what is the difference between the two. And I'm not someone who can answer that from a professional background.
Sure. You know, when we talk about vaccines, we're not talking about sterilization, right? Sterilization is a term that we use. We can't really sterilize the body. The way vaccinations work is that they introduce your immune system to parts of the virus or a weakened or inactive version of the virus or bacteria, so that when it sees it in the wild, so to speak, it's able to recognize it and mount an immune response immediately. So I'm not quite clear about this terminology around sterilization, because that's not a term that we typically use with vaccination. So if you can send me that correspondence or information, we can look into that. I will say that one of the things that we've seen is an increase in kind of alternative ways to describe things that we don't necessarily use in the public health or the healthcare space. And so I don't really think the term sterilization is appropriate in the context of vaccines, but I'm happy to look into that.
Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. Switching gears a minute to opioids. I saw that you mentioned that the opioid percentages, we had a slight decrease this year over 2020. 2020, obviously, we saw significant increases both in overdoses and fatal overdoses. So I guess this is a little bit of a two-part question. When you say that we're seeing a slight downturn in 2021 from 2020, is it the overdoses or the fatal overdoses or both? And then how does our 2021 data compare with 2019?
I'm going to start, but I'm also going to invite Sandy O'Neill back up again. So when we started the year, we saw that our overdoses were a little bit lower in 2021 compared to 2020, but our overdose deaths were a little bit higher. That trend for overdoses has continued throughout 2021 to be a little bit lower than in 2020. The deaths have actually started to trend down a little bit so that they're a little bit less than in 2020 as well.
Sandy O'Neill, Director of Behavioral Health, Department of Health. Just to build a little bit on what Dr. Kalyana Raman was saying, we're, I would say, cautiously optimistic, but keep in mind those numbers are still high and they're much higher than we would like them to be. And the opioids that are out there are dead. So yes, we are down and we're very thankful that we're not seeing 30% increase as being seen elsewhere nationally. But those rates they're somewhat variable. We have a dashboard on our website and you can kind of check into that. We update it weekly and you can see how those numbers vary. We're certainly still, I think, still in the single digits in terms of the down?
I think the best way to think about it is we're not getting worse, but that's not the same thing as getting better.
Okay, so we're still higher than 2019 for both of those numbers.
I'm not sure the
I would have
comparison
to-
at this point.
I'd have to look at the data. I'm
Yeah.
sorry.
Okay.
I can get back to you on that.
Okay, thanks.
Sarah Lacey, District 1. I'm going to jump in with a question about school and neighborhood violence. There's been a series of fights recently at Meade High School that are arising out of a conflict within two different neighborhoods, and teens, you know, fighting over that. They bring it to school, they bring it back home. And the entire school is affected as the principal has sort of taken away freedoms and other flexibility in the schedule from the entire school in order to deal with the violence. And so one of the things that I've been looking into are, you know, organized ways that we can use county resources in addition to community volunteers, you know, peacemakers. They're already out there trying to work in the community, but I think we may need bigger organized efforts. And so what plans, if any, does the health department have to try to, you know, help address this, right? These kids are essentially in a, you know, a bit of a powder keg, right? Where they haven't been together in person for, you know, for a year, and a lot is just coming out that not everyone can deal with. So I'd appreciate your thoughts on that.
Sure. So I'm going to invite Adrian Meikler up to talk a little bit about the mental health task force, and I can talk a little bit about some community programs as well.
Good morning, Adrian, Director of the Mental Health Agency.
Ms. Meikler, can I ask you to hang on a second? Something about the microphone in your room. Dr. K, your voice comes through okay, but whoever sits on your side tends not to come through okay.
Don't know what to say.
Do you have, can you move a microphone or anything?
IT folks to help answer this one. Don't know.
Another suggestion, Madam Chair and Dr. K, perhaps switch seats. If Dr. K, your seat is working well, you might be in the perfect seat for that.
Sure.
Thank you, Madam Secretary.
Good morning, Adrian Meikler. I'm the director for the Mental Health Agency. For 2 years now, we've been working with the school system in partnership with the Mental Health Task Force, identifying some basic areas that need to be addressed as far as the mental health needs for our youth. We've developed an array of programs to support those needs, identifying such things as access to care, stigma, substance use disorders, the entire continuum of our behavioral health care being addressed by different programs. A significant area recently has been training, making sure that as many staff and community members as possible are aware of signs and symptoms of mental illness, and helping the community be aware of what programs are available. There was a slight pause during COVID, but we still met regularly to continue to develop those programs and to make sure that the community is aware.
And then on the community side, can you hear me well?
Yes, thank you.
Probably just because I yell. It's fine. And so on the community side, I think that, there's a couple of different things happening. Partnership for Children, Youth, and Family do a lot of work in communities in terms of addressing community factors, at-risk individuals and families. This is also the work of what we're talking about with the gun violence intervention work, is to, and we mentioned that third objective, which was to identify areas of violence and then provide those services to others who are related to that person, friends, family, community, to really decrease that violence. So that's a growing area that we're targeting.
And if I could also add, the entire time during COVID, and you can see the slides that were presented, our crisis response system has never stopped. The demand for services has doubled, and we did anticipate an increase in calls, not just due to COVID, but with the fact that school being back in session and the children had not had in-person school for so long. We did anticipate the increased need, and just addressing those as they arrive as best as possible, making sure that the school and the school support staff and the children have the support staff we can offer.
Thank you. Ms. Radvian?
Thank you, Madam Chair. Lisa Radvian, District 6. Madam Chair, you asked nearly the same question that I was intending to ask, so I will ask a follow-up question. We've had similar circumstances in District 6 at Annapolis High School, where there have been ongoing fights and things that have come out of the community and materialized in school. So I'll just ask one follow-up question. In the weekend, I guess not this weekend, but last weekend, I heard from many teachers and staff members at Annapolis High School who were themselves feeling the impact of, being in a sort of ongoing, perpetual, volatile school environment. And I'm curious if there are any resources for those teachers and staff in the schools as they are impacted as sort of secondary, I guess I'm not sure of the terminology, but they're experiencing the secondary impact of, the same trauma that students in their schools are experiencing. And it sounds like there are some good community resources. There are some, a range of resources. I'm sure no matter what they are, we could, as a community, we could offer more. There's always a need for more in the area of mental health, but I was wondering if there's anything for, anything available for staff.
I'd like to invite our crisis response director, Jen Corbin, who has actually been on site at that district pretty much continually.
Good morning, everyone. Jen Corbin, Director of the Anne Arundel County Crisis Response. Just to bring you up to speed there, we were actually there all day yesterday, as well as the day of the incident that you're talking about, as well as follow-up days. We are working hand in hand with the principal and the school there. We have been linking people to resources and also we have done 2 debriefings with the teachers, as well as actually working with the health department, school nursing to also provide support. There is definitely a feeling, I will agree, but we are in there trying to link people to resources as they need them, as well as connecting them to their own EAP. But we are constantly walking through there. In regards to the concern for security, I think police are trying to work on that. Not only do they have 2 resource officers there, but our CIT officers have in 3 of the days been standing at the doorway greeting people, doing it in a more compassionate and therapeutic way. And that allows us also to help support the teachers as the students arrive at the beginning of the day. So there's a lot of coordination between school, police, health department to address this issue. I do believe that it needs to continue though. There needs to be a little bit more discussion on how we can support our teachers in all of the schools right now as students are adjusting to going back, but we are very aware of what's happening at Annapolis.
I'll just say thank you again very much. You're obviously a step ahead of me, and please let us know as we go forward how the council can support you in upcoming budgets to support our students as well as the staff. Thank you.
Thank you. Ms. Fiedler?
Thank you, Madam Chair. Amanda Fiedler, District 5. So I want to go back to the pediatric discussion on COVID. So looking at the state's website, it looks like statewide there are 7 pediatric hospitalizations in the entire state. I don't see how many of those, if any, are in Anne Arundel County. And if you have that information, I'd be interested in it. But I'm wondering, just as a larger discussion, because I'm looking at our dashboard as well, and it looks like proportionately when you're looking at ages 0 to 29, the number of cases in the past 4 weeks, they're the higher populations, but they account for less than 1% of hospitalizations. Are we on a path to identifying why children are not getting as sick from COVID-19?
So I'll start with just a little bit of data, and then we'll get to how children are reacting. So we looked at our data on hospitalization from the beginning of June to about mid-September, and we saw there was 20 people who were 19 or younger who were hospitalized during that 3.5 month span. Of those, 13 were either 11 or younger, and so they were not eligible for the vaccine. Of those 7 who were 12 to 19, 6 were not vaccinated, 1 was vaccinated. And so that's the data we're seeing in terms of how many of those 19 and younger are getting hospitalized, and also what the vaccination status is for them. I'm not sure that there's a great answer that I'm aware of as to why children are being affected less. I think sometimes that's just the nature of the virus. When we look back about 100 years to the flu pandemic of 1918, 1919, we saw that younger adults actually in the 20 to 30 range were the hardest hit. And so while work will continue on why that's the case, I don't know that we have an answer, just that is the case for COVID.
Thank you.
Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. Just to follow up on that line of thought. So as this disease kind of progresses and becomes more endemic, does that give any instruction on kind of how we deal with this forever moving forward? Since I think it's pretty clear at this point, it's not just going to go away. It's going to be here, and it's just something we'll have to deal with, forever.
Yeah, I think the most likely is that it is going to become an endemic disease, as you know. And endemic doesn't mean that it goes away, right? It just means that it is with us, and it's going to be kind of like the flu is. The flu is an endemic disease as well. We see bursts of activity during cold and flu season. We expect that for COVID, there will be, if not annual vaccinations, some schedule of vaccinations, just as we're seeing boosters right now for the Pfizer vaccine. And a booster is approved for Pfizer 6 months after the second dose. This week, Moderna and J&J are being evaluated by the FDA for boosters. So the strongest likelihood is that this will be something along the lines of a periodic vaccination to boost immunity is what we expect.
Ms. Fiedler?
Thank you, Madam Chair. Amanda Fiedler, District 5. I'm going to follow up to an part of your answer, Dr. K. You mentioned that this week Moderna is going to be evaluated for the booster. Is there an anticipated timeline for when that booster will be available? I don't know if there's like a typical timeline once evaluation starts.
Yeah, so our understanding is that the booster is the same dose as the current, which we have on hand. So as long as there isn't any dose change, and we don't expect there to be, we have it available. Thinking back to a few weeks ago with Pfizer booster, we have those doses. And so once it was approved, we were able to, educate folks about that, and people started getting it. So there really isn't a lag in terms of providing those doses.
Does anyone else have a question? Ms. Rodian.
Thank you, Madam Chair. I just remembered one more thing I wanted to ask, and this was about the possibility of requiring COVID vaccines, obviously once they're fully approved for young people in the schools going forward. I don't know if this is a decision that can be made at the county level or if this is a state level decision. So just curious what you know about that, what your thoughts are, anything you've got to share.
Sure. So this is obviously an area of active discussion in our county, in our state, in the country, and it goes to the heart of vaccine preventable illnesses and those risk safety profiles. In terms of our state, the State Board of Education can require vaccinations. So can the County Board of Education can also do the same for the ACPS school system. And the Board of Health can also do the same for students attending school throughout the county. So there are multiple mechanisms in our county for a vaccine requirement to be put into place with a slight difference for the Board of Education and Board of Health in terms of who would apply to. In terms of understanding what sort of decisions need to be made around this, we've seen some larger school districts in the country make these determinations that the COVID vaccine is going to be a requirement for attendance. And we in the county here are bringing together an advisory work group to look at this issue to make recommendations based on data in our county as to what would be the best course forward. So in the coming weeks, we'll be meeting with them. We're just in the beginning stages of putting that together. We'll have more to say on that. But I will say that all the data that we see shows the safety in children for whom it is approved currently, both the full approval, FDA Pfizer full approval for the 16 and older with the Pfizer product, and then the EUA for the 12 and over as well. While there was the data provided for that approval in the 12 to 15 range, we've seen a lot of millions of vaccinations in that age group since that was approved. And the safety profiles continue to be excellent, all of which kind of bolster its not just its efficacy, but it's also safety and its utility in keeping school open. I'll finish by saying that one of the things that I think is really critical to understand in the school setting, particularly, is that there's safety for the children, there's safety for that child getting vaccinated, there's safety for those other children. It's why we have required school vaccinations, right? It's not just that individual, it's also the spread. And particularly during COVID, if you're vaccinated, you do not have to be quarantined if you do not have symptoms. So all the quarantines that we are talking about are exclusively in unvaccinated children, assuming that they are without symptoms.
Ms. Pickard.
Thank you very much.
Good morning. Thank you, Madam Chair. Good morning, Dr. Kalyana-Raman and key leaders behind you. I just wanted to take a minute to say thank you, not only for your daily leadership, but for your amazing ability to answer our questions today. And just give a shout out to the 893 county health department employees for the enduring work that y'all do every day in the county. So thank you.
Thank you.
Anyone else? Last call. Okay, seeing none. Thank you, Dr. Kalyana-Raman, and thank you to all of your panelists, everyone in the health department, for not only for your being available today, the excellent presentation we received. I'm sure if anyone has any other follow-up questions, they know exactly how to reach you. And so thank you. Keep up the good work. Please know that we all, are very thankful for what you're doing. And at this time, we're going to take about 5 minutes or so to transition from all of our health panelists to our panelists from the administration to go into our discussion of bills. So if you could try to be back in 5 minutes and then we'll start. Thank you.
Hold on, it was muted. It was muted. Testing 1, 2, 3. We're good. It was red.
Madam Secretary, are we ready to begin the work session?
Madam Chair, it looks like we have Mr. Pruski, we have Ms. Rodvian. As the other members join here, I would say go ahead and get started.
Should we call the roll again or skip that part?
Sure, I'm happy to call the roll. one more time here. Okay, we'll start with you. Ms. Lacey.
Present.
Ms. Pickard.
Present.
Mr. Volkey. I believe Mr. Volkey had to depart. He was here for the health presentation. Mr. Pruski.
Still here.
Ms. Fiedler.
Present.
Ms. Radvian.
Present.
Hare.
Present.
Ms. Schuett.
Present.
And Ms. Bolair.
Present.
Madam Chair, we have 6 council members. We have our legislative council and our county auditor in attendance.
Excellent, thank you. We'll go right into it. Bill number 7721.
Madam Chair, I'm sorry for the interruption. We did have a request from the Health Department to discuss Resolution 48 first because of the staff, I think, that may be needed for that resolution.
That's fine. Let's do that. Resolution number 4821. Mr. Barron, are you going to take the lead on this one then?
I'm happy to kick us off, Madam Chair. Good morning, everyone. Pete Barron with the administration. Can you all hear me okay? Good. I should have joining us from the Office of Law, Mr. Hamilton Tyler, from Budget, Mr. Stephen Giroux, and from Health. In addition to everybody who's still in the room, we have the wonderful Miss Billy Penley. So this resolution approves the application to the United States Department of Justice for the Edward Byrne Memorial Justice Assistant Grant. This is the 3rd time, I believe, this council has seen a resolution like this related to this grant come before you all. The terms of the grant require that a resolution be passed by the county council. The amount of the grant this year is $150,462. There are no matching fund requirements. The monies will be used for a contractual paralegal to provide mental health services, for a juvenile reentry navigator position, and the Heal Violence Community Violence Intervention Program. The folks on the Zoom are happy to help answer any questions the council may have.
Thank you, and I'll remind everyone to please state your name and office, especially if you're a panelist. Does anyone have any questions? Apparently there are none. Okay, well, thank you all very much for making the time to be here. Have a great day. Okay, we will now go to bill number 7721. Mr. Barron.
Thank you, Madam Chair. Pete Barron with the administration. Joining me from the Office of Law is Mr. Jason Fetterman from OIT. Lee Fields, I believe, is joining us. Mr. Gary Houston is out on leave today. Bill 7721 approves the transfer of control of the Arundel Broadband LLC, known as, we all know it as the Broad Stripe provider, from Wide Open West Mid-Michigan Holdings to Star Power Communications. Per our franchise agreement, this transfer is subject to the approval of the County Council via ordinance. We have the reps from OIT and Law here to answer any questions you may have. I think, and Mr. Fetterman, correct me if I'm wrong, folks who are customers of this program need to see their contracts honored. This won't change any of the existing contracts. This is just improving the transfer of ownership.
Jason Fetterman from the Office of Law. Mr. Barron's completely correct in that.
Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. So that was going to be my question. So the existing customers, nothing changes for them? I mean, literally no changes at all? Just the name on the ownership?
You might have to send your bill to a different PO box, but yeah, I think so.
Okay, perfect. Thank you.
Anyone else? Any questions? Looks like that's it. Thank you, folks, for being here this morning. Have a great rest of your day. And on to bill number 7821. Mr. Barron.
Thank you, Madam Chair. Pete Barron again. Joining me from Record Parks is Miss Erica Matthews, and from Law, Miss Christine Niederer. Bill 7821 is a pretty cool bill, if I do say so myself. It approves the county's acquisition by gift of 2 adjacent parcels totaling 6.1 acres in Crownsville. The owners of the parcels wrote the county expressing interest in gifting the properties to the county to be incorporated into the adjacent Bacon Ridge natural area. So this gift will expand that natural area by 6 acres and change. The administration and the county DPW performed an environmental assessment, found no environmental contamination at the properties, and the budget office has reviewed the proposed acquisition and concluded that the proposed gift will have minimal fiscal impact, with the benefit of adding 6 acres to the Bacon Ridge area. We are here we have experts from Rec and Parks and Office of Law if you may have any questions.
Mr. Pruski.
Madam Chair, Councilman Andrew Pruski, I just wanted to be added as a co-sponsor for this piece of legislation for the record. Thank you.
Anyone else?
Madam Chair.
Ms. Rodvian.
I like my colleague's idea and would also request to be added as a co-sponsor.
Noted. Anyone else? Any questions? Is there bacon in these 6 acres? That's what I want to know.
I don't think DPW.
Okay, well, thank you to the panel for your time. We're going to move on to the next bill, bill number 7921. Mr. Barron.
Trying to find that mute button, apologies. Joining me from personnel is Ms. Badowski and Ms. Lovett, and from law, I believe Ms. Lori Blair Klausmeyer. Bill 7921 deals with the Deferred Retirement Option Program. Bill 7921 will allow employees covered by the Fire Service Retirement Plan with at least 20 years of actual plan service to begin accumulating pension benefits into an interest-bearing account for a fixed period of time prior to separation from county services. The changes will allow the fire battalion chiefs to participate in the program. So this is a program that exists, and currently there are 8 battalion chiefs. This will allow, I believe, the 6th year of participation. I probably screwed that up, so if somebody from personnel can correct me, but I believe they're allowed to participate beyond their 5th year into their 6th year. This is consistent with the negotiations between the county and union officials representing the battalion chiefs. So if I screwed that up, personnel, please correct me.
Ann Badowski, Personnel Officer, Office of Personnel. Let me just, you were mostly right. The DROP program does exist. The battalion chiefs are currently eligible to participate in that, and they currently do. There are currently 8 battalion chiefs in that. What this bill allows for is their enrollment in the 6th year without appointing authority approval, which they currently have to have. So similar to other classifications in the public safety that no longer have to have appointing authority approval for the 6th year, that is what this is allowing. And there's currently there are 8 battalion chiefs currently in the drop, only 1 in their 6th year. So the other 7 will be, forthcoming into their 6th year in 1 to 5 years.
Are there any questions? It appears there are none. Thank you, Ms. Badowski. And we will move on to bill number 8021. Ms. Pickard and Ms. Radvian, you are co-sponsors of the bill. Ms. Pickard?
Thank you, Madam Chair. Good morning, everyone. Bill 8021 is a bill that an issue we addressed in a previous bill that did not pass regarding, let me get my notes because it's been a while. Violation of grading before you're in site development and clearing of trees of significant size, AKA specimen trees. Currently, it's only a Class C offense. This bill brings the offense into, makes it equivalent to the state maximum of a Class A fine up to $10,000 with factors which are considered for each violation: your gravity, willfulness, environmental impact, cost of restoration, etc. I'm sure Mr. Johnston or Mr. Barron would be able to talk more to the specifics, but we're closing that what was couched as a loophole and making bringing the fine for that offense up to the state maximum.
Mr. Barron?
Sure, thank you. Pete Barron with the administration. Ms. Lori Rhodes, our Deputy CAO for Land Use, Matt Johnston, our Environmental Policy Director, are joining me along with Mr. Badami from IMP and Ms. Kelly from Law. I want to thank the sponsors for working with the administration. Councilwoman Pickard stated it correctly. This is sort of the quote unquote fix bill to a issue that we attempted to fix with a different bill that had some issues and ended up not being successful. Everybody huddled after that and came together to really address the problems that we're trying to tackle here, which is making sure that the forest conservation law that this council passed is effective and closed, as Ms. Pickard characterized it, a loophole that allowed individuals to circumvent the intent of that law. Mr. Johnston, I am definitely not the person to talk the specifics on this bill. Mr. Johnston, if you are able and can give a couple of seconds about the mechanics of it, feel free. Otherwise, we're happy to answer any questions.
Sure, Mr. Barron and Ms. Chair. So, Madam Chair, so this bill, want to thank the sponsors for working with us on it. Basically, it doesn't create any new regulation here. It's already a violation of our code to clear more than 5,000 square feet of land without a permit. So we already go out and send both inspectors and foresters on those sites where there are potential violations to determine how many square feet were cleared and if any trees were cleared. All this bill does is says, if we go out to one of those sites and we find that trees of significant size, AKA specimen, AKA larger than 30 inches in diameter, were cleared, then the fine can go up from $500 to $10,000 to protect our largest, most intact forests that are made up of the largest trees. So that's the idea behind this bill, and happy to answer any questions.
Mr. Pruski.
Thank you, Madam Chair, Councilman Pruski, District 4. I just want to be added as a co-sponsor on the bill, and that will be it. Thank you.
Madam Secretary, if the record could reflect Mr. Pruski, but also kindly add me as a co-sponsor to the bill. Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. So if it's currently a Class C offense, I think Councilwoman Pickard said, what is the current fine? And then I've heard a couple people say we're closing a loophole, but if we're not changing policy, we're just increasing the fine. What loophole are we closing?
Sure. So
Madam Chair. Oh, sorry.
No. Go ahead, sponsor.
Well, I think, thank you, Allison Pickard, D2. I think the closing the loophole was what was couched in the newspaper article regarding a situation in the Annapolis area with clearing of trees. There really wasn't ever a loophole, but that's how it was couched. So I was just trying to hearken everybody's memory back to a conversation from a few months ago, because it has taken us a little bit to come back with this bill. It is just, I think there was a feeling that the violators that were of that situation were only fined $500, and people felt that was that was just ridiculous. So we wanted to make sure that the fine was equivalent to the crime, so to speak, without adding additional tree regulation that made some of us uncomfortable.
Okay, thanks.
Ms. Rodvian?
Thank you, Madam Chair. Lisa Rodvian, District 6. I also wanted to just clarify that this still, like the Forest Conservation Act, does not cover the clearing of hazardous trees. So if you have trees that are dying or in danger of falling on, a house, or where, people could be out and about on a regular basis, that it wouldn't fall under the definition of clearing at all. So this still leaves, if you have several dead trees that would fall into that category of hazardous, there would be no penalty under this bill.
Ms. Schuett, did you have a comment? I thought I saw your flag.
Ms. Pickard already addressed what I was going to say.
Okay, thank you. Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. So just for the record, when I look up the definition for clearing, it is a form of development that means a process of cutting or removing trees. So we're not talking about one tree, it would be multiple trees. Is that correct, Mr. Johnson?
Sure, Madam Chair. Matt Johnston, Environmental Policy Director. It can be just one specimen or one tree of significant size when there is a violation of clearing more than 5,000 square feet of land. So again, the first threshold to cross is that 5,000 square feet of disturbance. We send inspectors out there. Oh, wow, we see sawdust. Let's get the foresters out here and investigate. Sometimes they find one small tree. Sometimes they find 25 large trees. That'll be the investigation that will occur.
Anyone else? Seeing none? Okay. Thank you to this panel. Make our Monday nights easier when we're talking about this bill. Ordinarily, we would go on to bill number 8121. Mr. Volke is the sponsor, and he is not with us during the work session. I still think that if someone wants to talk about it, we're all gathered together for that purpose. But if no one wants to, that is fine too. Okay, seems no one wants to talk about that bill right now. Let's move on to bill number 8221, of which I'm the sponsor. This is a bill that will conform our towing signage law to state law, which has now defined the term regional mall. And of course, in my district, we have one very, very big regional mall known as Arundel Mills. And if you were to apply our existing code about non-consensual towing and the signage that's required, it would result in an absurd number of signs having to be put up, as well as just confusion over how all of the parking lot would be covered and what number actually would be required. So state law being updated is very helpful. It will instead require that there be appropriate signs placed at each entrance into the parking lot, of which there are still plenty in Arundel Mills. I'm sure you've all been there and seen how many entrances there are to the parking lot. But this, in effect, it will obviate the need for signs to be placed on any of the like interior islands in the parking lot, which was going to cause specifically for Arundel Mills a lot of issues with where they would push snow around and their overall capacity for vehicles. And my dog has a lot to say about that. Mr. Barron, would you like to jump in?
Thank you, Madam Chair. I think your summary was pretty good. I think this is, well, actually, sorry, apologies. Pete Barron with the administration. Joining me from the police is Lieutenant Haviland, and from law, Mr. Kern Ritter. So the administration has no objection to the bill. As you noted, we're kind of conforming the law to what is now existing state law. Appreciate everybody working together to sort this one out. Common sense.
We like to do commonsensical things when we can. Does anyone have a question? Okay, apparently not. Thank you very much to the panel for being available today. Have a great day. And we will move on to bill number 8321. I believe I should offer this to you first, Mr. Barron.
Thank you, Madam Chair. Pete Barron with the administration. Joining us is, I believe, Mr. Kai Ziegler and Ms. Lynn Miller from Office of Planning and Zoning, and Ms. Lori Blair Klassmeyer from Office of Law to take all the tough questions. 8321 amends the sunset date of Bill 5521. So as you all recall, over the summer, we all worked together to pass a bill that extended the authorization for some flexibility related to outdoor seating at restaurants. Restaurants have been an industry that have been particularly hard hit by the pandemic. Many customers have a lot of apprehension about going inside into a closed space where everybody, by the very necessity of the activity that exists in there, has to be unmasked for at least a portion of their time there. So we all know that outdoor activities are safer. However, we had some rules around outdoor seating and where it could be that were restricted. Under emergency powers, the administration put some flexibility in them as those emergency powers came to a close. We needed to pass legislation to extend this. I think we all had hoped we were at the end of the pandemic, but as the discussion earlier today indicated, and when we passed 5521, the Delta variant wasn't really a thing we thought about. So what Bill 8321 does is an emergency bill, pretty simply just extends the flexibility contained in 5521 from the deadline that was November 1st of this year, which is coming up, all the way until January 2nd, 2023. The idea being, let's get through this. Let's put some additional flexibility through the summer and into next fall. And hopefully by then, we've got this thing finally behind us. But the administration thought it would be wise to put a long tail on this one. So with that, hopefully this is a 7-0 vote. Appreciate the work that many members of the council have put in on this issue over these last several months, but hopefully this bill is seen as common sense extension. So hopefully, well, let me just leave it there and ask, make ourselves available for any questions you may have.
Does anyone have any questions? Apparently not. Okay, thank you to the panel. We'll move on to bill number 8421. Mr. Barron.
Thank you, Madam Chair. Joining me from Central Services is Ms. Anderson, our director, and Mr. Daniels from our real estate department. I am not sure Ms. Kathy Koch, the executive director of ACDS, did have an important meeting. She had to join at 11 o'clock, so we may have just lost her. I will do my best to answer any questions that may be directed at Ms. Koch, but if there are any that I can't answer, we will circle back and get them back to you. And then Ms. Niederer from Office of Law. This is a exciting bill. I mean, we've got a couple of pretty exciting bills today, but this one is very meaningful to the administration and I think to the community. This approves the lease for the county-owned property to the Boys and Girls Club of Annapolis and Anne Arundel County. Sorry, the property is the Severn Intergenerational Center, or the Severn Center that we are building to finally provide a community center. It's the culmination of a lot of advocacy from many of our state elected officials, many of our county elected officials, and most importantly, a whole host of community leaders. The Boys and Girls Club will be responsible for all maintenance, repairs, replacements for their portion of the building, and this includes, but not limited to, interior maintenance, cleaning, electrical, plumbing, mechanical, HVAC, and the structure itself. Under the lease, the Boys and Girls Club shall pay all costs and expenses relating to the operation of their part of the facility. And the lease is for 50 years and provides for one 50-year renewal at the cost of $1 per year. We're happy to answer any questions. As a reminder, the other portion of the building is going to be operated by the county's Department of Aging and Disabilities as a senior activity center. This is a much needed asset that's going to serve the folks in and around the Severn community for many, many years to come. So we're very excited to see this take off. With that, happy to answer any questions.
Thank you, Mr. Barron. Sarah Lacey, District 1. Madam Secretary, please add me as a co-sponsor of this bill. And for clarification, Mr. Barron, or perhaps Ms. Koch, thank you for joining us. Who has the responsibility for the maintenance of the gym?
Ms. Koch?
Good afternoon, good morning. I'm Kathy Koch, Executive Director for Arundel Community Development Services, the Boys and Girls Club. Well, that is part of this lease.
Thank you. Ms. Hare?
Thank you, Madam Chair. Jessica Hare, District 7. Under this lease, does that then mean that no other community members who are not part of the Boys and Girls Club would be able to use the facilities that are being leased to the Boys and Girls Club, or would the county still have the ability to run other programming and things like that in the portion of the building where the Boys and Girls Club will be?
Again, Kathy Koch, Executive Director with ACDS. Second part of the question, not the first part. Second answer, not the first part. Yes, the county will have total access to it, just like they actually have an experience that they're going to build upon, which is the Wiley H. Bates Center and the gym at the Wiley H. Bates Center, which the Boys and Girls Club and our county's Department of Parks and Recreation have a well-established relationship, and that will continue at this facility here, and it will definitely be made available to other people in the community.
Okay, thank you.
Ms. Fiedler?
Thank you, Madam Chair. Amanda Feather, District 5. So with regard to the Boys and Girls Club, fantastic organization. And I think it's a great opportunity, but just out of curiosity, was there a process, RFP process or anything to determine that Boys and Girls Club specifically would get that space over any other organization?
Again, Kathy Cope with ACDS. No, there was not an RFP process. A lot of the funding that is coming into the project, I don't know if everybody has seen the list of the alphabet soup of the different types of funding that's funding this. The funding that is coming because a lot of the funding is coming because it is the Boys and Girls Club, and because the Boys and Girls Club is set up specifically to serve low to moderate income communities. And that's why a majority of the funding is there. So it's actually the Boys and Girls Club who brought a lot of the funding to the project.
Great, thank you.
Anyone else?
I'm just glad Ms. Koch was able to join us.
Me too. And I'm sure everyone is welcome on November 12th to the groundbreaking ceremony, which is going to be fantastic. So please come. Okay, so it looks like no one else has any questions on bill number 8421. Okay, thank you. We will move on to bill number 8521. Mr. Barron.
Thank you, Madam Chair. Pete Barron with the administration. Joining me is our Deputy CAO for Land Use, Ms. Lori Rhodes. From Office of Planning and Zoning, Mr. Steve Kaiziegler and Ms. Lynn Miller, and from the Office of Law, Ms. Lori Blair Klausmeyer. So 8521 is related to adequate public facilities and our school chart. The purpose of this bill is to reinstate provisions under Bill 9217 and 1518 that's sunsetted with the adoption of the General Development Plan. Bill 8521 will restore state-rated capacity for the purposes of APF to 95% capacity. So the administration believes that this bill is necessary to keep reducing the strain on our school capacities and allow the administration and the county the time to pursue the larger APF reforms that we are currently working through. I skipped a section in my notes, so I apologize. I'm going to go back a step. The other important provision, in addition to the 95 for elementary and middle school, it will continue the other, I guess you could call it, compromise from 2017, 2018, which allows an exemption from APF for schools for 5 or less lots rather than 3 or less lots in a subdivision of single family dwellings that have been owned if the developer has owned the property for at least 3 years rather than 5 years. So we're keeping it at 5-3 instead of 3-5, if that hopefully makes sense. The good news is we have our experts, Ms. Lori Rhodes and Mr. Stephen Kaiziegler and Ms. Lynn Miller, and Ms. Lori Blair Klausmeyer, if council has any questions.
I start to bet sometimes whether or not we'll have any questions. Well, I know which bet to take this time. Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. So my question is on the process of the updates in here, because I know we've talked about that a couple of times in the past, and I was happy to see this kind of projections that planning and zoning would be doing to take into consideration predicted happenings. Is that, I know that this is something I had specifically asked that the work group consider. Is that where this is heading? Maybe planning and zoning could just give an update on kind of that piece of it.
Sure. Steve Kaiziegler, Planning and Zoning Officer. I want to stress one thing when we talk about student projections or forecasts. It's not the Office of Planning and Zoning who develops those. Those come directly through the Board of Education. But to get to the other part of your question, we're more than halfway through, I would say, in the work involved in the public school APF work group. We have another meeting, our next, I believe it's our 10th, scheduled for the end of this month. We're expecting the ability to be able to start making recommendations late spring, early summer. And I think they will be far reaching. I think we're going to be recommending a different approach to school APF than the ones that we have employed in the past. I hope that helps answer your question.
Ms. Hare, did that answer your question or not?
Well, so in section E, it talks about approval and it talks specifically about the planning and zoning officer. So I just want to clarify who's doing updates and approvals based on this.
Again, Steve Kaiser-Ziegler, planning and zoning officer. There is some language in the code in the past and now that references the planning and zoning officer or the Office of Planning and Zoning doing certain work. The reality is the forecasting, the data sets that are used to regulate residential development through school APF are prepared through the Board of Ed through projections they make in their annual public facilities master plan. What we do is we take that data and we insert it into a chart with whatever percentages we've decided to regulate student enrollment and new development with. So I'm going to say the heavy lifting on the forecasting of student generation does come from the Board of Ed, although the language does read as though OPZ or I am the one creating it. It's very much a collegial cooperative arrangement that we have with the Board of Ed. They give us the raw data based on all of their methodologies, and I don't really want to speak for them. It's very, very complicated. And what we do is we take that raw data and we insert it in the charts that we use for regulatory purposes.
Ms. Pickard.
Oh, thank you, Madam Chair. Allison Pickard, District 2. As a member of the school APFO work group, I just wanted to speak to the work just briefly, just add on to what Mr. Kaiser-Ziegler has spoken about. And we have come to a really good place in the last 10 meetings. It is very detailed, data-driven work that we're examining and working across all the stakeholders to come up with a really pretty much a wholesale overhaul of the way we look at school APFO. Our calculations have improved with regard to student yield generation, over the years. And so we are, since about 20, I'm going to get my dates wrong, but over the last 3 or 4 years, the school system has become a little more sophisticated, looking at student yield generation rates based on everything from house type, house size, zip code, age of the home, things like that. And we're starting to really drill down and see the picture countywide and be able to predict better, see how our forecasts played out to accuracy from before. And we're really beginning to see what student yield generation looks like, which will allow us to really make better land use decisions and such into the future. But it is time consuming and research heavy. And we've employed some folks from the outside. It's for those, I'm becoming a policy wonk in this area. Unfortunately, this is like the stacks of reports on my bedside table are a little embarrassing, but it is pretty exciting to think that we're going to be able to make some wholesale change. But it is also going to mean we're going to need to take the public through a change in how we think about capacity in our schools and how we think about housing and housing development in our community and what that means across the board. So we got a lot of work to do on many fronts. I don't know if that was helpful for anybody.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. So just looking at the exemption section of this bill, can someone just walk me through how you all landed on the flip of 5335 and what you think that that will change?
Go ahead, Pete. I'm sorry.
Yeah, no, it's fine. And you're gonna do the technical stuff, sir. Just briefly, Councilwoman, we're essentially keeping what the current rules are. So that was the rule that existed until the GDP was adopted, and then in that was basically what we're trying to do is keep I don't want to call it because I don't think it was crafted in that way, but as a sort of a compromise. As Councilwoman Pickard stated, a lot of work, as you know, is going into that APFO work group, and they're really looking at those issues. And the administration felt it was important to maintain the sort of status quo while all of this work is being done. And Steve, feel free to add to that.
So thank you, Pete. Steve Ziegler, Planning and Zoning Officer. Yeah, I'll just add a little bit. The implications of it, one way or the other, are pretty minor. But what we did notice is that there was a handful of projects that were what we call minor subdivisions, typically 5 lots or less, that were going to get caught in the sunsetting of the bill. We think it's somewhere around the size of 5 projects. They can't have any more than 5 lots. So the impact on the school system is negligible. And it just seemed to be more fair to go back to the way it was before the sunsetting.
Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. Mr. Ziegler, I apologize, and maybe I'm just misunderstanding what you were saying. I appreciate all the comments you've had. On page 3 of this bill, the chart, it defines the chart and talks about how it'll be revised once a year for the council to see. But then it specifically, page 3 at 175502A2 talks about how the chart will be updated by the Planning and Zoning Officer on May 1 and September 1 of each year based on approved developments and the projected number of new students that those approved developments would contribute to the school system. That's what I'm trying to get at. And so I'm just asking about kind of that process and how you envision that, whether the council maybe would get copies of that, et cetera, et cetera.
So again, Steve Ziegler, a very good question. I think things went awry a bit with the sunsetting of the bill. It caused some confusion. There was a chart prepared, I'm going to say in June or July, but another chart has to be prepared, and it's actually being worked on now by the Board of Ed. When I say developing the raw information that we will put in a chart form, and that's where I think there's some confusion. We're hoping to have that chart from the Board of Ed, or that data that we can insert into a chart in the next few days. And that will, I'm going to say, in some way, shape, or form, as a new bill or as an amendment to this bill, come forward for the council to see.
Okay.
But it's being worked on now. But I can't produce a chart unless I have the data, and only the Board of Ed can produce the data that goes into the chart.
Ms. Fiedler.
I think this may be a follow-up to that question. Amanda Fiedler, District 5. So this bill doesn't change what I think a lot of parents get frustrated with, in that the chart provided by the school system is dependent on certified numbers of student population by the state, which creates this like 2-year lag. That this bill doesn't change that portion.
It does not. And what will be in the chart that will come to this council is information contained in the Board of Ed's, I believe it's the FY 2021 Public Facilities Master Plan, which we signed off and has been approved by the state, I believe, in July. So no, there's no change to that methodology or that chart or that report.
Okay, thank you.
Anyone else? Ms. Schuett.
Thank you, Madam Chair. Linda Schuett, lawyer for the County Council. I don't have this really well formed in my head, but are there any folks who either agreed to increase capacity while the capacity was still at 100%, but now it's going down to 95%, or anybody who held 5-acre lots, but they were constrained by the 3 lots from May, whenever the May 3 through today. Is there anybody hurt by the fact that this is retroactive, is what I'm saying? Are there things that would need to be undone as a result of the change in the capacity standard or the acreage standard?
And Mr. Kai Ziegler, Pete Barron with the administration, Mr. Kai Ziegler or Ms. Miller can provide more information on this. But the school chart that is in effect currently would match these thresholds. So we never actually bumped officially back up to 100% for middle or elementary school. So nobody would be caught up in that. And I think Mr. Kai Ziegler referenced about 5 projects that would have been caught in the lower threshold for the minor subdivision portion of it, which this bill is attempting to reset back to the previous. I hope that made sense.
That's correct.
May I have a follow-up, Madam Chair?
Go ahead.
So what you're basically saying is that this bill really reflects what has been done since May, since the adoption of the GDP. This bill incorporates existing practice?
I think that's fair to say. I'm looking at Office of Law to correct me, but yes, that's.
Thank you.
Anyone else? Seeing none at this time, thank you to the panel. Have a great day. Bill number 8621, Mr. Pruski.
Thank you, Madam Chair. Andrew Pruski, District 4. Just to give folks a little bit of history, so in November of 2017, the previous council, which I served on, initially passed 8117, which was the initial 5-year property tax credit for public safety. This bill essentially moves that from 5 to 10. There is no blue letter yet because obviously we haven't had council meeting as the Madam Auditor is smiling, but that will be coming. I believe, though, that this is good policy. Why? First of all, if any of you have talked to our police chief or fire chief recently, applications are down for public safety. So if there's anything that we can do to not only have them live in our county, but provide a small benefit, I think it's worth it. Again, I think this is good policy. And financially, I think when the auditor's blue letter comes out, you won't see that it has a tremendous fiscal impact. So again, this is just a slight tweak of that initial law, and I hope I can get everyone's support. Thank you.
Thank you, Mr. Pruski. Madam Secretary, please add me as a co-sponsor to Bill 8621. Administration, Mr. Barron?
Sure, Pete Barron with the administration. From our budget team, we have Mr. Hasim. From finance, Ms. McQuaid, and from law, Ms. Kenny. The administration supports extending the duration of this tax credit to our public safety officers. As Councilman Pruski stated, this is a tweak, a slight expansion to an existing credit. I think finance can probably go into a little bit more detail or on the number of credits, but we basically have somewhere in the low 700 number of credits that are being granted. So that's it's not a huge impact, but it's very meaningful to our public safety folks who receive the credit. So with that, the administration is supportive and happy to answer any questions. And Ms. McQuaid, if you want to talk in a little bit about the scope of this, or Mr. Hasim about the fiscal cost, or we can always wait until Madam Auditor has a chance to do her work.
Karen McQuaid, Office of Finance. Yeah, just for FY22, we had 725 approved applications, and tax credit was $1.6 million. And the tax credits have been pretty consistent in the 700s over the past couple years. They go up and down a bit from 703 in the first year, 730 in FY20, 758 in FY21, and then 725 this year. And they're consistently around an average of between 2.1 million and this year 2.25 million, just the average.
Ms. Pickard?
Thank you, Madam Chair. Allison Pickard, D2. I would like to also be added as co-sponsor to this bill. Thank you.
Anyone else? It appears not. Okay, thank you to this panel. Have a great day. We will move on to bill number 8721. This bill is sponsored by me, Mr. Volke, and Mr. Pruski. It is pretty straightforward. It just repeals the prohibition against serving alcoholic beverages during commercial bingo games. This came up when Bingo World, which is in District 1, wants to be able to serve alcoholic beverages. They feel it's important to be able to remain competitive with other entertainment venues in the county. And I don't know if they're planning to get into sports betting or not, but their thinking is, we should open it up a little bit here. And so that's what this bill is for. Mr. Barron.
Thank you, Madam Chair. Pete Barron with the administration. From our Office of Law, Mr. Ritter is stuck around to join us for this one. The administration supports this bill. I think Madam Chair covered it correctly. The genesis or the existence of this prohibition goes way back in the day. Since that prohibition exists, the state has created licenses for slot machines, and now we are all the way up to sports betting. And it's sort of an artifact of an earlier time that this prohibition exists. So it makes sense to modernize the code to bring it more in line to other similar activities. So with that, we support.
Any comments? Other than noting that Mr. Volke and I almost never co-sponsor the same bill. I can only take that shot because he's not here. Okay, it doesn't look like anybody has any comments. Going once, going twice. All right, thank you to this panel. We will move on to the last item on our agenda is resolution number 4721. Mr. Barron.
Thank you, Madam Chair. Impressed that we are wrapping up before noon, so let's keep the questions. Pete Barron with the administration, sticking around to the very end with me from Central Services is Ms. Anderson and Mr. Daniels, and from Law, Ms. Niederer. This resolution approves the determination of two non-buildable county-owned properties known as Drum Point Avenue and Crane Highway in Glen Burnie. Drum Point Avenue properties include a couple of lots that total 0.03 acres and 0.08 acres. The property on Crane Highway is 0.051 acres. The council has been provided a map of the surrounding area as part of the legislative package. If the council approves, Real Estate Division will proceed with disposing of this property. This is in an area that the adoption of these properties will allow some redevelopment to occur, and it is in Councilwoman Pickard's district. So with that, we're going to ask you when this bill is heard, or this resolution is heard, to pass it. So happy to answer any questions.
Are there any questions? Seeing none, every stomach is thinking about lunch, as far as I can tell. All right, well then, I think we can adjourn this meeting. We'll see you all on Monday for our second Monday night meeting of the month. Take care, have a great day.